If you're feeling stressed, you likely reach for a pair of headphones. Music is often treated as a passive escape, a way to tune out the world. But using music as a background track leaves some of its most specific biological benefits dormant. Many of us live with chronic stress, a sense of social isolation, and shallow respiratory habits. We look for external solutions to these problems, often ignoring a corrective mechanism that is already part of our biology. There is a physiological threshold between listening to a sound and being the one who produces it. Active participation triggers a cascade of biological markers that remain inactive in a listener. We are going to track how group singing alters the immune system, shifts hormonal balances, and uses cardiac synchronization to create social bonds that differ significantly from other group activities. The research suggests that the act of gathering in a room to sing with others serves as a measurable public health intervention. Singing is a physical demand. It requires forced lung expansion, specific posture, and core engagement, functioning as a form of specialized aerobic training. UK studies found that this respiratory work improves expiration pressure and lung capacity in patients managing COPD and lung cancer, proving the training has a direct impact on respiratory health. This chart shows immune activity changes during a choral session. Studies recorded a significant increase in cytokines, proteins coordinating immune responses, and this line tracks SIgA, a primary antibody in our immune defense, which rises notably when we sing. This is the Royal College of Music, where researchers teamed with Tenovus Cancer Care to study how singing affects patients. They found it reduces stress-induced immune suppression, which is linked to better outcomes during treatment. These combined respiratory and cellular changes indicate that singing provides the body with a measurable defensive advantage. The focus moves from cellular immunity to the brain. Choral singing requires a rare level of concentration. The singer must simultaneously track their breath, the director's cues, and the sounds of those around them. Chorister Kathy Moodis describes this as a state of clarity and stillness. The demand of 100% focus acts as an active form of mindfulness, crowding out external stressors. This graph shows the hormonal response to that focus. During a session, levels of the stress hormone cortisol drop, while mood-enhancing endorphins are released into the system. This is the University of Gothenburg, where researchers investigated the physical dynamics of the group itself. Because singers coordinate their breathing to the music, their heartbeats physically synchronize. The group begins to pulse in unison, creating a shared calming state. This synchronization, paired with a significant hormonal shift, provides a physical counterweight to the symptoms of anxiety and depression. These individual biological changes scale up into community impacts. Choirs often provide a sense of belonging so strong that members describe the group as a second family. This is the campus of Oxford Brookes University, where sociologists compared the bonding experience of choral singers to that of sports team members. The data showed that singers viewed their groups as more meaningful social units than the athletes did, suggesting that creating music together forms a deeper social connection than competing together. This social inclusion has clinical benefits. In care homes, group singing improves the mental performance of Alzheimer's patients more effectively than music listening alone. The choir acts as a social safety net, anchoring cognitive function and protecting individuals from the biological impacts of isolation. Viewed through this evidence, the human voice is more than an instrument for performance. It is a biological tool for maintaining health and group cohesion. This tool is increasingly used by younger generations. As seen in this image of a championship-winning youth choir, the medium has seen a surge in engagement across all ages. To recap, active singing strengthens the lungs, lowers cortisol, increases SIgA antibodies, and provides a necessary social anchor. Finding a local group is a matter of participation, not professional skill. As choral director Wilson Fowley notes, the bond comes from the shared experience of creating beauty together. Taking off the headphones and singing out loud with others is one of the most accessible ways we have to strengthen our biological resilience.